Hello, and welcome to Back to Living, a surgical preparation class for patients who are undergoing a spine fusion surgery. It is our privilege to care for you. You have a whole team on your side, and we will be here for you every step of the way. We thank you very much for entrusting our team here at St. Joseph Regional Medical Center with your care. Some of the things we will talk about include general information about spine fusion surgery and how you and your family or loved ones can participate as the most important members of your healthcare team. Who else will be on your team while you are here in the hospital? Possible complications after a spine surgery, how to prepare your home before surgery, improving your outcome by being healthy before surgery, planning ahead, what to expect from before surgery to after returning home, concerns after surgery, as well as when and who to call. We will then learn some exercises for you to practice before and then after surgery. And then we will demonstrate some equipment that may be helpful to you as you transition safely back into your environment. You will also be provided with contact information, which can additionally be found in your spine educational booklet, Back to Living. There are different reasons why a patient may decide this is the right time to undergo spine fusion surgery. The most common goals of surgery are to help reduce your pain and symptoms and to improve your quality of life. In other words, help you get your life back from pain and limitations. Many patients undergo spine fusion surgery in the United States every year. Here at St. Joseph's, we care for a high volume of spine patients annually, which means we provide an extra level of expertise. Please rest assured that you are in good hands. Again, we thank you for entrusting us with your care, and we recognize that no two patients are exactly alike. We closely monitor our program and our patients' outcomes, and we work continuously to achieve a smooth process with excellence and safety for our patients. One of the things that empowers us the most to be the best we can be is your feedback. Please provide us with feedback along the way. You can give this to any staff member at any point. Your insight is invaluable to us. Your commitment to this process is imperative. When patients are highly involved in their care before, during, and after surgery, they generally have better outcomes. Gone are the days where you do something just because your doctor or nurse told you to. We want you to know and understand and be active in the conversation and decisions regarding your care. This concept is known as shared decision making. Even if your surgery is weeks or months away, start preparing now. Starting your pre-operative exercises before surgery can help your brain and body to be more successful with movements after surgery, especially for lower back surgery. One thing that is very important is for you to identify what your goals are ahead of time. Then, keep your goals in mind as you travel through this process. What are you hoping to get back to after surgery? Exercise, playing, hunting, gardening, working, or dancing? Keep your eye on your goal, especially when you are having pain. It is a great way to propel yourself toward a smooth recovery. In other words, look through this time frame to your healthier future. Let's talk about your surgery. Spine fusion surgery means your surgeon will make an incision, remove things that may be pressing on your nerves, such as bone spurs or an extruded area of disc. Next, your vertebrae or bones in your spine will be stabilized or fused together. The specific technique chosen for you will be discussed with you by your surgeon. Please make sure all of your questions about your exact surgery have been answered by your surgeon. Most spine fusion surgeries go very well, but we want you to be aware that there is a chance of complications. This is not to scare you, but rather to then discuss what can be done by you and your whole team to help minimize your risk of complications. Here are some of the most serious complications to be aware of. First up, infection. Surgical site infections can lead to additional surgery, disability, and antibiotics. There is also a risk of developing other respiratory, skin, or urinary tract infections. Next is nerve damage. This can lead to permanent or temporary disability. Bleeding. Bleeding can lead to the need for a transfusion or other fluid replacement. This can be life-threatening if not immediately treated. There is also a risk of failure of your spine to fully fuse, which could mean additional surgery and symptoms. Also, spine fusion can put additional stress on the spine levels on either side of the fused area, leading to the need for additional fusions. It is possible to sustain damage to the vocal cords, swelling of the face with some vision loss, or a leak of spinal fluid, otherwise known as a dura leak. Other possible complications include an adverse reaction to anesthesia, such as a heart attack, breathing difficulty, or death, or an adverse reaction to any of your medications, such as an allergic reaction. The last complication we will talk about is blood clots. Blood clots are a serious, life-threatening risk after surgery. Typically, blood clots form in the calf area, but they can also form in the arms. There is a risk that they could travel from your limbs to your heart or lungs. There are many things that we do to help greatly minimize your risk of forming blood clots after surgery. You will have soft compression sleeves on your legs, known as sequential compression devices or SCDs. You will be up and walking the same day of surgery. Your surgeon expects it. You will learn some exercises called ankle pumps, and we will encourage you to stay hydrated by drinking plenty of fluids, both in the hospital and after you go home. We will monitor you closely throughout your stay and teach you about the signs and symptoms of blood clots. Please know the signs and get help if you need to. Your healthcare team includes an anesthesiologist and a certified registered nurse anesthetist. This is a physician or an advanced practice nurse that is responsible for your anesthesia or putting you to sleep and controlling your pain for surgery. A discharge planner is a member of the social work team that will work closely with your surgeon, care team, and you to help make decisions and arrangements for your discharge process and destination. They can also help answer questions about insurance coverage for services or equipment you may need after surgery. Environmental services or housekeeping will be in and out of your room, helping to keep it clean and comfortable. They help to maintain our environment of safety and excellence. A hospitalist is an internal medicine physician who is employed by the hospital. They may be asked by your surgeon to help oversee and manage your entire state of health during your stay. Occupational therapists may be asked by your surgeon to assist you in learning how to use certain adaptive equipment. This equipment can help for a smooth transition back to self-care after surgery. Specifically, they teach you how to complete your activities of daily living, or ADLs, independently. These activities may include toileting, dressing, and showering. Next, our chaplains or pastoral care are here to visit with you about anything you would find comfort from talking about. From fly fishing to your Creator, it's up to you. They offer prayer support and communion if you would like. In addition, our chaplains offer assistance with completing advanced directives free of charge. Each member of our pastoral care team is a notary. If you are interested in this service or would like more information, please ask any of our staff at any time. At St. Joseph's, you will have a pharmacist involved in your care every step of the way. They will oversee and help to manage your medications. They assist your surgeon by providing feedback, recommendations, and management of your medications. The physical therapy team will plan and assist you with your physical rehabilitation after surgery. They will teach you some post-operative exercises as well as work with you on your individual home environment needs. These include things such as using a walker, going up and down stairs, getting in and out of bed, or anything else in your environment that may be a challenge for you after surgery. A physician's assistant or nurse practitioner is a healthcare professional that may work with your surgeon to assist in your overall total care. Our nurses are your advocates and are responsible for managing your overall bedside nursing care during your time in the medical center. They will support your relationship with your surgeon, provide you with care and education, and include your family as part of your healthcare team unless you do not want to have them involved. You may have a respiratory therapist assisting in your overall respiratory care while you are in the hospital. They may provide breathing treatments if ordered and work with you to learn your breathing exercises. Last, but certainly not least, is your surgeon. This is your partner who will perform your surgery, direct your care, and guide you through your rehabilitation process. Now let's talk about some important ways to prepare your home before surgery. Let's start with putting clean sheets on your bed and having freshly washed towels for you to come home to after surgery. Also, if there is a specific chair or sofa that you will be spending time in after surgery, it's a good idea to place a clean blanket or sheet on it. Doing these things can help to reduce the amount of bacteria that you are exposed to in the days following surgery. This helps to minimize your risk of a post-operative infection. Even though you will have some protection from your surgical dressing, you still want your environment as clean as possible until your incision has healed and closed. It is a good idea to grocery shop and make meals ahead of time. You can store some in the freezer for quick access. Keep in mind, if you have had a neck surgery, that you will want soft, easy-to-swallow foods, but don't skimp on the fiber. Also, make arrangements for someone to help with your laundry and meals for 2 to 3 weeks after surgery. You will not have the strength or energy to stand for long periods of time or to lift heavy items like a basket full of laundry. If you are responsible for the care of people, whether children or adults, or you are responsible for the care of pets, please arrange to have someone else care for them in the days surrounding your surgery and for several weeks after. It is important to remove all of your throw rugs temporarily. These rugs are a big fall risk to you, and a fall after surgery is the last thing that you want. Also, it is a good idea to place night lights in areas that you may be in at night, such as the bedroom, hallways, and your bathroom. This also helps to prevent falling. Because you will be temporarily using a walker after surgery, look around your home and imagine that you are using a walker. Do you have clear pathways through your home? Do you need to rearrange some furniture so that you have a safe space to travel with your walker? Please ask friends or family for help if you do need to rearrange your furniture. This could further injure your back or neck. Another area that is a high risk for you to fall is the tub or shower. Please place non-slip surfaces in these areas. You will have some activity limitations or precautions for a time after surgery. We will discuss these specifically later in this class. But one thing that is helpful is to temporarily relocate some of your most frequently used items closer to waist level. Also, it is helpful to place pillows in low seats that you may use. This can help you get up and down more easily. It's a good idea to arrange for someone to pick up your mail and to prepay your bills ahead of time. This will give you several weeks after surgery before your bills are due again. If you have a condition known as obstructive sleep apnea and use a CPAP machine at night, please have your machine cleaned and up to date with its service by the company that provided your machine. Then, bring your machine, clearly labeled with your name and phone number, to the hospital. Smoking robs your bones and tissues of much-needed oxygen. This becomes a significant risk for you after surgery in the following ways. It reduces your body's ability to heal and can lead to poor outcomes after surgery. In other words, your spine may not fuse, leading to poor outcomes, poor healing, and additional surgery. Smoking also increases your risk of developing breathing-related complications during and after surgery. We are passionate about your health, so we want to encourage you to stop smoking. Stopping for even a short time before surgery can greatly increase your chance of a successful outcome. We have a smoking cessation program called Tobacco Free You. You have a list of contact numbers in your Back to Living handbook. Please refer to this list for the phone number. Also, for the health and safety of our patients and staff, St. Joseph Regional Medical Center is a tobacco-free campus. This includes all tobacco products. Vapes and e-cigarettes are included. Many of us tend to underestimate the importance of a healthy diet in having a good surgical outcome. Eating a healthy diet right now will make a difference in how you heal after surgery. It will give your body the nutrients to repair damage to bone and tissue after surgery, and it will support your immune system. It is a good idea to eat healthy, lean, high-quality proteins like chicken, turkey, beans, lentils, tofu, or eggs, as well as plant-based healthy carbohydrates, including whole grains, fruits, or vegetables, as well as healthy fats such as avocados, nuts, olive, or coconut oil. It is important to avoid sugary desserts, highly processed foods that have trans fats or partially hydrogenated oils, and high fructose corn syrup. Proper hydration is important before and after surgery. This also helps to boost your immune system and to minimize complications like infection, constipation, post-operative pneumonia, or urinary tract infections. Drink at least 8 glasses of water each day and avoid drinks with added sugar or sugar substitutes. Avoid drinking alcoholic beverages or drink with great moderation. Alcohol really does not contribute to your nutritional status in any way. It is very important that you discuss all of your vitamins, supplements, and medications, both prescribed and over-the-counter, with your surgeon and with the nurses at your pre-surgery clinic appointment. Many of these can have a big impact on your surgery in the following ways: an increased risk of bleeding, an increased risk of clotting, interactions with anesthetic agents, or interactions with other medications. This is very important for your safety. We provide a safe and confidential environment for you before, during, and after surgery. Please honestly discuss with your doctor if you currently are or have been addicted to pain medications, or if you use any illegal or recreational drugs. This information is imperative for your team to be able to help you with pain control and safety after surgery. We want to work with you to develop a good plan of care that best meets your needs. Starting your pre-op exercises now will help your body and brain connect with these movements more easily after surgery. It is helpful to build this pathway before you have surgical pain. If you have specific questions about insurance coverage that have not yet been answered by your surgeon's office, please call your insurance company. Generally, coverage is verified prior to surgery. You will have the opportunity to fill out advance directives, also known as a living will, at any point while at St. Joseph's. An advance directive is a legal document that conveys your wishes for medical treatment or who should speak for you in case you cannot speak for yourself. This document is kept on file at the hospital and can be updated at any time. This service is provided free of charge. If you have not already done so, please call to schedule your pre-surgery appointment with the St. Joseph Regional Medical Center Pre-Surgery Clinic. You can locate the phone number in your Back to Living handbook. Also, fill out your health and medication questionnaire along with your discharge planning questionnaire and bring them with you to your pre-surgery appointment. At this appointment, you will discuss the information on these forms, as well as other important information concerning your surgery. You may also have some blood tests or an EKG of your heart. This information is important to help keep you safe during surgery and well under anesthesia. It is important that you have help throughout your surgical process from a kind of coach. This person is generally either family or a close friend. They will be an extra set of eyes and ears for you along the way, as well as a cheerleader when the going gets tough or long. They should also provide extra hands-on support at home with chores or meals. It will be important that your coach is also your chauffeur until you have been given clearance to drive. You will not be cleared to drive for a time after surgery. One reason is that you will be on prescription pain medication, and it is not safe or legal to drive while taking this medication. Also, you will have physical restrictions and disability, also making it unsafe. Consider having rings resized so they can easily be removed before surgery. It is not safe to go through surgery with jewelry in place. Your fingers can swell and the circulation could be compromised. It is also an infection risk. There are a few pieces of equipment that we will discuss later that you may want to consider borrowing or purchasing before surgery. A shower chair, an elevated toilet seat, a handheld shower nozzle, and a travel mug or thermos with a lid. Communication is very, very important. Please be sure that you have fully and accurately disclosed your personal health information to your surgeon and the pre-surgery clinic nurses. If anything should change, please notify your surgeon immediately, as well as the pre-surgery clinic. For example, any infections such as dental, bladder, skin, or respiratory, or if anything changes such as your diabetic status, urinary issues, or heart conditions. If you are prescribed a new medication, or if you start taking anything additional over the counter, please let your surgeon and the pre-surgery nurses know. By fully communicating this information, your doctor can work with you to optimize your health before you undergo this scheduled surgery. This is important for your optimal outcome. Now you are ready to pack your bags. Here are the things that you want to bring to the hospital with you. Most current list of medications, including what time each dose was last taken, clean, loose-fitting clothing, socks, underwear, and comfortable shoes for physical therapy. Also, you will want to bring toiletries, glasses, hearing aids, dentures, and your CPAP machine if you use one. Remember to bring important phone numbers, your cell phone and charger, or a calling card. Also, please bring your driver's license, photo ID, and insurance cards. You may find it helpful to bring pastime activities like a book or magazines. Please bring your Back to Living Spine Education Handbook. Please note, do not bring money, jewelry, or your own medications from home unless you are asked to do so by your pre-surgery nurses. Remove nail polish on at least one toe and one fingernail. This is important to monitor your oxygenation and circulation during surgery. As we talked about earlier, please remove all jewelry. If needed, take whatever medications as instructed by your pre-surgery clinic nurses. It is important that you do not eat, drink, smoke, chew gum, or chew tobacco past the specified time, which is typically midnight. If for some reason you have a different window of time, this will be discussed specifically with you. This is imperative to keep you safe while undergoing anesthesia. Life-threatening complications can and will happen when patients disregard these recommendations. Please be honest about these timeframes. Take a shower and wash with an antibacterial soap. It is important that you do not shave on or near your surgery site. When you shave with a razor before surgery, it increases your chance of a surgical site infection by making micro nicks in your skin. If needed, staff will shave your surgical site with special clippers that protect your skin. After your shower, pat dry with a clean towel. Do not use lotion, powder, deodorant, or makeup. Just stay all natural. Don't mind, we promise. Then put on clean clothes and, if instructed, take only certain medications with just a tiny sip of water. You do not need to bring your own walker to the hospital. One will be provided for you to use while you are here. Travel safely and arrive at the hospital at whatever time instructed. This is up to 2 hours before your surgery is scheduled to start. Please make sure that we have a way to reach you in case the time of your surgery changes in any way. Once you arrive, you can go directly to the day surgery department. You do not need to go to admitting. You will have completed the admissions process during your pre-surgery appointment. Your family can remain with you during your time in day surgery. This can be a busy time as staff helps you prepare to go to surgery. During your stay in day surgery, you will review your medications one last time, and your nurse will put that information into the computer for the timing of your next doses after surgery. You will also go over a quick review of your general health. You will have a skin check with 2 nurses to help make sure your skin is healthy for surgery, and then your nurse will help you to complete a skin preparation. This is important in fighting against a surgical site infection. You will be given a warming gown to change into. This can provide warm or cool air. Also, at this time, your consents for surgery will be reviewed and any personal items will be given to your family or transported to your room on the surgical floor. Your next stop will be the pre-op holding department. At this time, your family will be shown to the surgical waiting area. You will have an IV started. Some IV hydration can then be given to you through your IV line, as well as any medication. An anesthesiologist will talk with you to help answer any questions or concerns you may have about your anesthesia. Please notify them if you have ever had any complications with anesthesia in the past. Your surgeon will also talk with you to make sure all of your questions are answered about your surgery. Once you have talked with your doctors, you may be given some medication to help you relax before surgery. This is not a high-stress time. If you would like, you can listen to music for relaxation or distraction. In your operating room, you will have highly trained and specialized staff. This includes an anesthesia provider, your surgeon and their assistant, OR nurses and surgical techs, along with radiology techs and implant specialists. Safety is always driving your care. You will be specially positioned to help avoid putting excessive pressure on any area of your body. You will have monitors in place as you begin to go to sleep for surgery. Every member of the team will stop and perform something called a timeout. The whole team actively participates in this timeout before surgery begins. They will verify things like your surgical procedure and site, your personal identification, and your allergies. You will be given a preventative antibiotic before your incision is made to help reduce your chances of developing an infection after surgery. You will have soft compression sleeves on your legs, helping to reduce your risk of blood clots. The anesthesia provider will closely monitor and help to regulate your temperature through your warming gown. You will have general anesthesia for your surgery. This means that you will be asleep throughout surgery. Anesthesia is generally provided through both a breathing mask and an IV. You will be constantly monitored during your surgery. Your anesthesia provider will also give you pain and nausea medicine through your IV. Once your surgery is complete, you will be transported to the post-anesthesia care unit, also known as the recovery room. Surgery times vary depending on your exact surgical diagnosis and procedure, as well as the extent of surgical correction needed. While you are transported to the recovery room, your surgeon will go to the surgical waiting area to find your family and to update them on how your surgery went. After your family talks with your surgeon, they can then go to the surgical floor. As you start to awaken in the recovery room, you will have specialized one-on-one nursing care with continuous monitoring and your anesthesia provider readily available. Your recovery room time is specific to your individual needs. This will usually range from 1 to 1.5 hours. If this time extends much beyond this time frame, nurses from the recovery room will attempt to locate and notify your family on the surgical floor. Once you have transitioned away from anesthesia and are awake, your anesthesiologist will give the all clear for you to move up to the Center of Excellence on the surgical floor. The Center of Excellence is a dedicated area on the surgical floor where you will have specialized orthopedic staff. Your recovery room nurse will give a detailed report at bedside to your receiving nurse. We encourage you to actively listen and to comment if needed during all of your bedside reports. This is an important way for you to actively participate in your care. Both nurses will check your skin together as part of your post-operative assessment. Visitors may be asked to step out at this time to protect your privacy. Once in your room, your oxygen level and heart rate will be continuously monitored to ensure you are safely maintaining these levels on your own. You will have intermittent monitoring of your other vital signs like blood pressure, breathing rate, and temperature. Your nursing staff will also be watching you for any remaining effects from anesthesia or surgery. We will work with you to learn important breathing exercises to prevent pneumonia, and you will continue to have the intermittent compression sleeves on your legs to help minimize the risk of blood clots. Please do not get up without help. We are here for you, and it is our privilege to care for you. You will be a big fall risk after surgery due to many factors like medication, an unfamiliar environment, cords, and being generally weak and unsteady after surgery. Anytime you need to get up, we ask that you use your call light to ask for assistance. You will also have a bed alarm on for a time that will make a loud alarm noise if you are trying to get up and have forgotten to get help. You will have a lot of help very quickly. Staff will always use something called a gait belt when getting you in and out of bed and walking with you. You should also have non-skid footwear or socks on whenever you are walking. This is important to help prevent slipping and falling. As discussed earlier, your medications are ordered by your doctor and overseen and managed by a pharmacist and then administered by your nurses. For your safety, we will identify you each time by scanning your armband, as well as asking you questions such as your name and date of birth. Your medications will also be scanned into the computer to match you and your orders. Staff will explain your medications to you along with the side effects to be aware of. Throughout your hospitalization, we will assess you frequently for pain. We will ask about your pain rating on a 0 to 10 scale. 0 is no pain, 2 is mild, 4 is nagging and annoying, 6 is quite a lot, 8 is severe, and 10 is the worst pain that you can imagine. In addition to your number rating, we also want to know what type of pain you are having. For example, aching, burning, or sharp. It will be important to know the location and if anything such as a position change provides relief from the pain. Our goals for you are to help you meet your realistic goals. We emphasize realistic because we know you will have pain after surgery. A goal of 0 will not be realistic. A good goal is to help provide enough pain relief that you are still able to rest and participate in your activities while never compromising your safety. The best personalized approach will hit pain from many different angles. Cold therapy to reduce swelling, keeping your eye on those goals that you have identified, and getting moving so that your muscles don't become stiff from inactivity. Also, please honestly communicate your pain to your care team. This will help us to help you. Try not to worry about pain, but it will be important for you to understand your pain. One of the big culprits of pain after surgery is inflammation or swelling and the physical disruption of tissue. We call this acute surgical pain. There are some things that you can do after surgery to help minimize this type of pain. Cold therapy, also known as ice packs, good body mechanics and alignment, as well as walking and repositioning. Later in this class, we will demonstrate some cold therapy wraps that you may receive from the hospital if ordered by your surgeon. There is also something called acute on chronic pain. This is when a patient has a long history of pain and prescription medications to manage that pain, coupled with the acute pain of surgery. This presents a special challenge in managing your pain after surgery. Please discuss fully with your surgeon your history of pain medication use and exactly how much you take and how often. Not just what and how it was prescribed, but actually how you are using it. This will help your surgeon plan effectively for helping to manage your post-operative pain. As discussed, you will become very familiar with a 0 to 10 pain scale and helping to describe the exact type of pain you feel as well as the location. An important point to make here is that the response you get to a therapeutic dose of pain medication is the response you get. More medicine will generally not increase the response. It will only decrease your level of consciousness and your drive to breathe. This becomes dangerous to you. We work hard to keep you at a therapeutic level of pain management while never compromising your safety. Safety will always trump pain management. Let's talk about some common myths about pain management. Number 1, you should wait in bed because the pain is too bad to get up. After having a solid night of sleep, often each one of us will wake up feeling stiff and sore until we get moving. This same thing happens after surgery and can be exaggerated. Sometimes patients feel they hurt too bad to get up, but if they can push themselves in the moment to get up and walk, when they get back to bed, they rest better overall and with less pain. Myth number 2, you won't have pain after surgery. It is surprising how many people are shocked to have pain after surgery. Our surgeons have asked us to reiterate to you that you can expect to have pain after surgery. There is no way to totally avoid pain. Instead, we work with you to keep it manageable. Myth number 3, pain means there is something wrong. This is both true and false. Pain is protective to your body. It helps you know when something may not be right. If you place your hand on a hot surface, pain lets you know to remove it quickly, which is how it prevents you from sustaining further damage. Before surgery, pain was most likely letting you know that something wasn't right. After surgery, pain will be telling you that something big has happened and it didn't feel good. Like we discussed before, it is helpful to anticipate this kind of pain and control your thoughts about it so that you don't panic. Myth number 4, more pain medicine means more pain control. This is reiterating what we already discussed. Pain medicine has a point where it is no longer working more on the pain no matter how much you take. We will help to keep you safe while you are in the hospital. But once you go home, it will be important for your coach and yourself to help keep careful track of your pain medications so that you do not accidentally take too many. One thing that is helpful is to keep a tablet by your medication and write down each dose and time. You can also use pill boxes to help keep track. Myth number 5, you will become addicted to pain medication while in the hospital. Addiction happens over time. Your hospitalization is too short of a time frame to develop an addiction to pain medicine. However, there is a risk, weeks and months following surgery, that your body may continuously start to crave pain medicine. To avoid this, work to lengthen your time between doses and steadily decrease your doses in the days and weeks following surgery. Never take more pain medication than prescribed, and if you feel you need to, please inform your surgeon. They may need to prescribe a different medication for you. Myth number 6, you should skip exercises or physical therapy and walking when you are hurting. Like we talked about earlier, sometimes pushing yourself through the pain to get moving will ultimately help you rest better and will decrease your overall pain. walking is one of the best things you can do to help combat against back pain. You can even just walk loops through your home or in the mall. Once you are able to start eating and are tolerating some liquids with no nausea, your nurse will start to advance you toward a regular diet. Take it slow. Eating quickly can trigger nausea and complicate things if you are constipated. When you have started to eat solid food, you will be started on pain pills in preparation for your discharge to home. If you have any special diet considerations, please let your surgeon and nursing staff know. This would be any allergies, if you are diabetic, need a heart-healthy diet, or are vegan or vegetarian. Your family can either purchase a meal of their choice in the cafeteria, or they can order a tray to eat with you for a small fee. One of our dietary aides will come to your room to take your order for every meal. For your best outcome after surgery, we will help you to stand at your bedside and also to walk with assistance the same day of your surgery. This helps to greatly reduce your risk of complications after surgery, such as pneumonia, blood clots, and excessive pain. Standing will not cause damage to your spine, but it may feel uncomfortable at first. If your doctor has ordered a brace for you after surgery, staff will assist you to put this on and will teach you how to properly use your brace. You will have a walker and a gait belt for stability and safety. We have been asked by staff and physicians to talk about sleep expectations after surgery. Undergoing anesthesia often seems to interfere with patients' normal sleep patterns for at least the first night after surgery. This can leave your body confused about if it is day or night. Also, you will be in an unfamiliar environment with unusual sounds, a different bed and pillow, and you will be having some pain. Also, staff will be in and out of your room, keeping a close eye on you and your vital signs and pain. Try not to get frustrated about lack of sleep, but just focus on relaxing. Watching TV is sometimes a good distraction from the frustration of lack of sleep your first night. Staff will work to keep the unit quiet at night and to keep lights dim, creating somewhat of a quiet zone. We can also provide you with a white noise machine, a sleep aid if ordered, earplugs, and we can adjust your room temperature to better meet your needs. Also, by being active and walking and getting up to the bathroom, as well as breathing exercises and ankle pump exercises, you can help to wear yourself out in preparation for sleep. It is hard to sleep if you haven't moved much all day. Also, please tell us what you normally do at home to help with sleep. The next day after surgery, you will be busy. You will have some early morning blood tests and your IV fluids will be stopped. Your soft IV catheter will remain in your arm, but the continuous flow of fluids will be stopped. Your nurse will change your surgical dressings and will help you with bathing and personal care. Your nursing staff will help to teach you how to continue this on your own once home. You will be continuing to do your deep breathing exercises and to use your incentive spirometer, which is a device that will help with your breathing exercises. Also, don't forget to do your ankle pump exercises very frequently throughout the day. We will help to get you out of bed for every meal. It is helpful for you to spend small amounts of time out of bed in a chair, but no more than 30 minutes at a time. Our physical therapy team will work with you and possibly an occupational therapist if ordered. They will practice with you on how to get in and out of bed and getting your brace on if you have one ordered. This is where it is important that you bring comfortable shoes to the hospital as you will walk with your therapy team in the hallway. We will continue to assist you in getting up and down to the bathroom, which is actually good for you. You will not have a catheter in your bladder unless your surgeon decides one is necessary for your safety. Catheters provide an unnecessary risk of a bladder infection developing. It is much better for you to move back and forth to the bathroom. You will have many people in and out of your room. Some of these include our discharge planner and one of our chaplains. Try to rest between activities and visitors. You may go home the next day after surgery, especially if you had a neck surgery, or you may stay for an additional day depending on your specific needs after surgery. Your doctor will work with you and your nurses and therapists to find the right discharge timing for you. Once your surgeon has given discharge orders, these orders will be processed by the lead or charge nurse for the day. They will verify your orders, fax your prescriptions, verify your follow-up appointments, and print an educational packet for your bedside nurse to review with you. It is helpful to have your coach present when your discharge teaching is taking place. This gives them the knowledge and skills to help you at home, and it also provides a good opportunity for them to ask questions. You may not remember all of the information you are given at discharge, which is why an extra set of eyes and ears will be very helpful. Before you leave the hospital, you will be given an in-hand prescription for pain medicine and a walker. It is helpful if your coach can pick these items up before you leave or if they can get them on the way home. It is important to have these items when you are arriving home so you do not have to leave or be left alone. Your discharge planner will review your plan and check with you to make sure you have the support you need once home. Your bedside clinical nurse will make sure you and your coach know how and when to change your dressings. They will remove your IV catheter from your arm and help you to pack your belongings. They will go over all information in your discharge packet, including your surgery, your medications, any follow-up appointments you may have, as well as what your plans are for exercises. And they will review any complications that you should watch for. You will also have contact information in your packet as well as in your patient education handbook. The phone number to the nurses station on the surgical floor is a 24/7 contact number. You can speak with a nurse at any time if needed. You will also have the phone number for the nurse navigator. You may need to leave a message, but she will return your call. Once you return home, your coach should plan to stay with you for the first 24 to 48 hours. They should also be available to you at night for assistance with getting up and down to the bathroom and keeping track of your pain medications. Please make sure that you have help available even during the day should you need additional assistance with meals, laundry, or getting up and down. Don't forget, you won't be driving yourself for a bit, so your helpers will also be your transportation to and from any appointments. One thing I want to mention here is to be sure to remember to have soft foods on hand if you have a neck surgery. It is normal that you may have difficulties swallowing initially after surgery. This should improve over time. Smoothies are a great option because you can include protein, fruits or veggies, and whole grains like oats. This kind of smoothie is both nutritious and will help provide fiber so you can avoid extreme constipation. Here are a couple of things to highlight to you. Keep your surroundings as clean as possible until your incision has healed. Use extreme caution with pets. They can be a fall risk as well as an infection risk. Always wash your hands or have your coach wash their hands before changing your dressings. Ice, ice, ice. This can really help with pain and swelling. Just be careful to always have a layer between your skin and the ice packs so that you do not get frostbite. Follow the manufacturer's recommendations for safety on whatever system you are using. Elevation is something we normally use to decrease swelling. The only real way to elevate your back is by having you walk and sit up in chairs for meals. This can prevent some additional swelling that you could experience if you spend all of your time on your back in bed. Remember to continue your breathing exercises and ankle pumps until you have returned to a normal level of activity. Eat healthy and stay hydrated to give your body what it needs to heal and to keep your immune system as strong as it can be. Take your medications exactly as prescribed and call your surgeon if you need further directions or assistance. Last but not least, keep your chin up. Sometimes your brain begins to heal ahead of your body. You are anxious to get back to life, but your recovery process may be taking longer than you hoped. This is normal. Most patients experience a time where they may feel that life is passing them by. Try to keep focused on your goals and to distract yourself with hobbies or other activities. Before you know it, you will look back on this. You will have some precautions for a time after surgery. We call these the BLTs. This stands for bending, lifting, and twisting. For back patients, do not bend through your back. Instead, bend at the hips. For neck patients, do not tip your chin toward your chest. Keep your eyes and nose pointed forward and level. L is for lifting. Do not lift items heavier than a full gallon of milk, which is about 8 pounds. If you do lift something close to 8 pounds, keep it in close to your body. For patients with neck surgery, do not lift your arms above shoulder level. This puts additional pressure through your neck vertebrae. T is for twisting. Do not twist through the operative area of your spine. For back patients, this means no twisting through your back. Instead, twist by moving your feet. For neck patients, keep your nose in line with your sternum and do not twist through your neck. Simply speaking, keep your spine in good alignment as you heal. There is one additional precaution that is most helpful for back patients, but it is also helpful for neck patients as well. We call it the rule of 30 minutes. Do not sit longer than 30 minutes at a time without getting up and changing positions. Then you can sit back down. When you are sitting, you are putting 3 to 5 times the amount of pressure through your spine. This is okay for a time, but then you need to give yourself some relief before you sit again. If you have a long distance to travel in a car, find a safe place to pull over, like a rest stop. Get out every 30 minutes, walk several loops around your car, get back in, and continue. This is very important. Now we have some words of caution for you. It is very important that you do not submerge your incision underwater until it has fully healed and you're given clearance by your surgeon. You will be able to shower, but no tub baths, hot tubs, or swimming. Also, stay ahead of constipation. This is a major challenge after surgery. Our staff will send you home with information on how you can manage this at home, but if you have not gone and it does not seem to be improving, please call your surgeon for additional guidance. Another reminder, please do not drive or operate heavy equipment. You will not be twisting, as well as you may be weak, slow, and on pain medication. Please wait until your doctor tells you it is safe for you to drive again. Do not add any medications, over the counter or prescribed, without guidance and approval from your surgeon. Generally, notify your surgeon if you have any questions or concerns. Here are some important reasons that you should contact your surgeon once you go home. If you develop a fever of 101 or greater, or have chills and a cough, or are generally feeling very weak and achy. Also, if you have a sudden increase in your pain and swelling. If you have a sudden change in sensation or feeling in your arms or legs, or if you lose control of your bladder or bowels. If your skin becomes itchy or swollen, or has a rash. As discussed, if you cannot have a bowel movement. If you have trouble urinating and you have burning and pain when you do urinate. If you have persistent nausea or vomiting, or for any other questions about your surgery. Seek emergency care immediately if you develop signs of a surgical site infection. This would be if your incision becomes swollen, red, drains pus, smells foul, or pulls apart. Also, seek emergency care if you develop signs or symptoms of blood clots. Some of the signs and symptoms would be one or both of your calves feels warm, is painful, and swollen. It may look red as well. Just to note, occasionally blood clots can develop in your arms. If in your calf, you would likely experience pain when standing or with movement. This pain is often sharp. If the clot travels from your extremity, it may travel first to your lungs. If you experience chest pain, trouble breathing, suddenly feel lightheaded, or cough up blood, please dial 911. This is a life-threatening emergency. Also seek emergency help if you are actively bleeding. You may have some slight drainage on your dressings, but you should not be actively bleeding and soaking through bandages. Please get help immediately to stop the bleeding. Also, as we mentioned, if you have a sudden decrease in your sensation in your extremities or you lose bowel or bladder control, this is an emergency. Please do not wait until your doctor's office opens to get help. Get emergency help. Exercise is very important before surgery, while you are in the hospital, and after you go home. It is imperative that you practice your exercises as you are guided by your therapists and doctor. This will help you to have a good surgical outcome. Now, let's turn it over to our therapists.
Welcome to the Physical Therapy and Occupational Therapy portion of your Back to Living class. When you have had a surgical fusion of your spine, being highly proactive and compliant with physical therapy, walking, and following precautions is absolutely imperative. You will only achieve the outcome you want through a strong commitment to this entire process. This will mean learning when to push through your pain and when to back off. It is also important that you make a commitment to your overall health. To take the best care of your spine, take care of your whole body. Exercising before you come in for surgery is an important part of your surgical process. This helps to build strong brain and muscle connections that will help prevent spine injuries in your future. It will also strengthen the muscles that support your back, which will help improve your healing process after surgery. Following surgery, ankle pumps will help prevent blood clots from forming in your calves. As we discussed earlier, blood clots are a significant risk to any patient after surgery. It is important to practice these ankle pump exercises frequently after surgery until you have returned to a normal level of activity. Practice these multiple times per day, especially when you have been resting or not active. Flex both of your feet down vigorously, like you're pressing on the gas pedal of a car. Then pull your toes up toward your chin. Repeat this for about 30 seconds. Practice deep breathing exercises at the same time. Breathe in slowly, taking a deep breath. Then relax and exhale deeply. Deep breathing exercises should be practiced each time you practice your ankle pumps. The breathing exercises help to prevent fluid from settling in your lungs after surgery and becoming infected or causing pneumonia. The next exercise is called transverse abdominis. Your abdominal muscles are very supportive and protective for your spine. When these muscles are weak, you are at a higher risk for a back injury. By strengthening this muscle group, you will help improve your recovery as well as prevent additional back injury later in life. Lay on your back with your feet flat on the floor and your knees bent. Pull your belly button in towards your spine. Tighten your stomach muscles and hold. But here's the tricky part. Keep breathing while you hold. Most of us have a tendency to hold our breath while we flex our abdominal muscles. We will be teaching you to start any movement or exercise by first tightening your abs. Some of the things you may be doing will require you to keep flexed for a longer period of time than you can hold your breath. You will hold for 3 seconds, release, and repeat. Practice this 10 to 20 times each session. After surgery, you will be using your legs to help get up and down. This will help minimize any bending through your spine. Having strong quadricep muscles before surgery will put you at an advantage after surgery. This exercise is called the quadriceps set or quad set. Lie in bed with your leg out in front of you. Push the back of your knee down into the bed, tightening the thigh muscle. Hold for 3 seconds and then relax. Repeat this exercise 10 to 20 times. Gluteal sets are also known as glute sets. Your gluteal muscles, or buttocks, are important in providing stability for you after surgery. Glute sets are an important exercise to strengthen these muscles. Simply put, you will squeeze your buttocks together tightly. Hold this for 3 seconds and then relax. Repeat this 10 to 20 times. On each side of your spine, you have small muscles called multifidus. These muscles provide additional support for your spine. During surgery, this group is often disrupted by the surgery itself. It is important to help these muscles work again after surgery. This exercise will be important for you to practice and learn before you have surgical pain. This exercise is called pelvic floor with hook-lying adduction. Lie down with your feet flat on the floor and your knees bent. Squeeze a ball or rolled up towel between your knees. At the same time, contract your pelvic floor muscles as if you're stopping the flow of urine. Hold for 5 seconds. Repeat 10 to 20 times. Now we will work on another leg strengthening exercise combined with flexing your abs. This exercise is called heel slide with transverse abdominis. Lie on your back with your legs straight out in front of you. Pull your belly button down toward your spine and hold tightly as your stomach muscles contract. Slide your heel toward your buttocks, bending your knee as far as possible. Straighten slowly and release your stomach muscles. Repeat these 10 to 20 times each session. The next exercise is called the sitting ring of stability. This again will help strengthen your core, which will provide additional support to your back. While sitting up tall in a chair, pull your belly button toward your spine and hold. Bear down like you're having a bowel movement. Finally, pull your pelvic floor up and in. Hold this for a count of 5 to 10. Repeat this exercise 10 to 20 times per session. There are several exercises that are in your booklet that we will not demonstrate here. These will be important for you to practice as well. These are heel raises and mini squats. Please refer to the exercise portion of your booklet for these exercises. You will be using your arms after surgery to get in and out of chairs or bed. This will help to prevent additional painful bending through your spine until you have healed after surgery. The supine triceps extension exercise is important to help you build strength in your arms before surgery. You will rely on your arms and upper body to assist you in getting up and down from a seated position or in and out of bed. Lay down on your back, bend your knees up for comfort. Lift one arm up over your head and bend the elbow so it points directly at the ceiling. Holding the weight in your hand, keep the elbow in the same position and straighten the arm so the weight is going up towards the ceiling. Return to start position. Repeat this 8 to 10 times with each arm. Practice this next exercise also to assist with arm and upper body strength. This is called a seated press-up. Sit in a sturdy chair with arms. Press down with your palms to lift your buttocks up out of the chair. Hold 3 to 5 seconds and then slowly lower yourself back down. Repeat this 10 to 20 times. You may already have altered how you get in and out of bed just because of pain and disability through your spine before surgery. After surgery, this will become even more important to protect your spine while it heals. You will be getting in and out of a bed using the log roll technique to prevent twisting your spine. Lie on your back, then tighten your abdominal muscles to bring your knees up one at a time. In one motion, roll completely onto your side. Do not scoot back to the middle of the bed. Next, pull your knees up closer to your chest in somewhat of a crouch position. Start to drop your feet over the edge of the bed while at the same time pushing with your elbow to sit up. This should be in one smooth motion to sitting in an upright position. To get back into bed without twisting, you will reverse this process. There are 2 steps. Step 1 is, from a sitting position, flex your abdominals, then lay clear down onto your shoulder and bring your feet up onto the bed at the same time. You should be in a total side-lying position the whole time. Step 2 is, with your abs still flexed, in one log roll motion, roll to your back. You may be prescribed a brace to wear after surgery for additional support for your spine until it is healed. We will demonstrate some common braces. After your surgery, if a brace has been ordered for you, staff will teach you how to take your brace off and put it on. Here is an example of one type of neck brace. Most braces have similar characteristics. Here, we will demonstrate a commonly used back brace. Let's watch. After surgery, you will be prescribed a walker to be used for stability until your muscles have strengthened and healed a bit. It is common for patients to be weak and unstable in the days and weeks following surgery. For your safety, while you are in the medical center, staff will assist you to get in and out of bed, as well as in and out of chairs, and in and out of the bathroom, as well as to walk. They will always use something called a gait belt to protect both you and themselves from sustaining injuries from a patient fall. They will help you use a walker as well. It is important that you learn how to use the walker correctly. Let's review the safe way to get in and out of a chair and walk after surgery. First, make sure that your walker is properly adjusted to the height of your wrists. Notice that staff are using the gait belt for safety. Also notice that you will be keeping your spine straight as you get up, minimizing any bend. Do not pull on the walker to stand, it will tip. Instead, push up with your arms. Also, it is important to avoid getting ahead of or behind the walker. Keep focused when you are learning. It will quickly become a habit to use good technique. Follow the instructions of your surgeon on how long you should continue to use the walker after you go home. The length of time varies from patient to patient depending on individual factors. Walking is the best exercise for backs. It helps to heal and decrease pain in the back. Please walk. After surgery, you will need extra help for a time before you transition completely back to caring for yourself. As we discussed earlier, it is important that you have a helper or coach to support you after surgery as you regain your independence. After most back surgeries, patients may struggle for a time with basic activities of daily living, or ADLs. ADLs include basic care activities like getting dressed, showering, and using the toilet. If occupational therapy is needed for you after surgery, our therapists will come to visit you while you're in the hospital. They will provide you with some adaptive equipment and they will teach you how to use this equipment. Let's start with the sock aid. The sock aid will help patients who have any physical precautions or constraints that keep them from being able to bend down far enough to put their socks on. Begin by pulling your sock onto the sock aid until the toes are flat at the end. For longer socks, you can simply accordion the sock over the device, but be sure to have the toes flat against the end. Then, go fishing for your foot. Place your foot in the sock aid with your toes pointed down. Using the ropes, pull the sock aid up towards your calf, and voila, your sock is on. The next item that patients often find helpful after surgery is a long-handled reacher or grabber. This is helpful for many things, picking up items from the floor or getting dressed. Let's watch how you can use this to help get yourself dressed. Next, we will learn how to get your shoes off and on without always needing your coach to assist you. We will use two pieces of equipment together to accomplish this: the long-handled reacher or grabber and the long-handled shoe horn. To take off your shoes, place the shoe horn on the back of your shoe and gently push your shoe off. It helps if you have loosely tied shoes to begin with or a slip-on shoe. To get your shoe back on, grab the tongue or top of your shoe with the reacher. Place the shoe horn in the back of the shoe. Insert your toes first and then slide your foot down the shoe horn and into your shoe. If you have lace-up shoes and are having difficulty, we can provide you with elastic shoelaces to temporarily replace your regular shoelaces. This turns a lace-up shoe into a slip-on shoe. The next place that people often find challenging after a back surgery is the shower. It will be important that you purchase, rent, or borrow a simple shower chair to use in the weeks following surgery. The shower is a fall risk after surgery. Generally, shower seats are not covered by insurance, but if you would like to clarify, please call your insurance company. These can be purchased at your local medical supply store, large chain general store, or possibly a secondhand store. Also, you may want to borrow one from a friend, a relative, a church loan closet, or the senior center. Take time to find a shower chair and also a toilet seat riser or elevated toilet seat before surgery. We will talk about the toilet seat in a moment. One word of caution: if you are using this equipment secondhand, make sure to sanitize the items completely before you use them. This is important in helping to prevent a surgical site infection. When getting into a tub shower, back up with your walker until you feel the tub wall on the back of your calves. reach back with your arm and find the seat. Move your walker aside. Lean back slightly and with both hands on the chair for support and balance, lift your legs one at a time over the ledge of the bathtub and into the shower. This is basically the same way you will get in and out of your car. We will work with you to learn this while you are in the hospital. Once you are in the shower, you can use a long-handled sponge to scrub hard-to-reach areas like your feet and back. Rock side to side on the seat to wash your bottom area. After your shower, while you're still sitting, wrap a towel around the long-handled sponge, keeping a grip on the ends of the towel, and use it in the same way to dry off hard-to-reach areas. Generally, the thing patients least want help with after they have a surgery is toileting. Your occupational therapist can help you learn how to use the toilet independently after surgery. First, an elevated toilet seat is very helpful to have after surgery. This can be attached to your toilet itself, or you can remove the bucket from a freestanding bedside commode and place this over your toilet. It is helpful to have handles or something that you can safely grab onto to assist with getting up and down off the toilet. As we talked about previously, generally these are not covered by insurance, but take the time to locate one if possible. The next item that can be very helpful after surgery for patients that have a difficult time reaching behind to wipe is a toilet aid. Squeeze the handle to open the tongs and wrap a generous amount of toilet paper around the end of the toilet aid. Be sure to leave a tail of toilet paper for you to grip so that it does not unravel while you are wiping. Stand and squat and then reach back to wipe. It is helpful to have a plastic bag lining your trash can that you can unravel the paper and drop it into. This helps prevent a mess around your toilet. One of the best things that you can do after surgery to help control your pain is to help control your swelling. Cold therapy or ice packs are very important when it comes to reducing swelling. After surgery, while you're in the hospital, you will be given a cold therapy wrap with 2 sets of gel packs. We will teach you how to safely use these gel packs while you are staying in the hospital. Follow the directions completely once you're at home to prevent any skin injuries like frostbite. Do not sleep at night with this on, but rather use during your waking hours. For neck surgery patients, here is how you place the wrap around your neck. For back surgery patients, here is how you place the gel wrap around your back. In summary, you have a whole team to cheerlead and help teach you how to get back to your regular life, resulting in a great surgical outcome. We cannot stress enough the importance of appropriate exercise and practicing this faithfully. Be patient with your recovery. It is a process that you will look back on.
Thank you very much for choosing St. Joseph Regional Medical Center for your surgery and care. We are with you every step of the way. Please know that you have a team of experts on your side. We are together in health.